Hello, my name is Jason Semprini with the University of Iowa College of Public Health, the Department of Health Management and Policy, also a pre-doctoral NIH research fellow at the University of Iowa College of Dentistry. And I'm happy to share with you my research today, which tried to answer the question, are rural Americans exposed to more innovative Medicaid dental health policies? And here we identified the approaches to expand the supply, demand, and innovativeness of Medicaid dental service delivery. So, just some quick background. If you look in the top left corner here, so low income adults disproportionately have poor oral health outcomes, most notably due to the fact that there are considerable dental shortage areas in these rural regions. And to accommodate such reality, policymakers have become quite creative in how to increase utilization and adopting more innovative policies. Uh, but the question still remains if these innovative policies are being targeted to individuals in rural areas and to what extent they're being implemented and exposed to low income rural adults. So I focus on a few of the more innovative policies, one being teledentistry coverage, which is gaining a lot of momentum with the COVID-19 pandemic, but also Medicaid waivers, where a state can quite considerably adapt their Medicaid program to better fit the needs of their state residents, as well as state oral action plans. And so, just quick looking at our aims here, we conduct a state by state policy scan to identify Medicaid dental policies, and we review and code these to see if the states do in fact have a waiver, a state action plan, or uh, teledentistry. And then we compare the proportion of rural adults living in these states to the proportion of non rural adults living in these states. And we do so just by first calculating the number of adults living in poverty in each state for both rural and non rural counties. And so that creates this very simple calculation where we take the number of low income rural adults living in each state that covers teledentistry divided by the total number of low income adults. And then we compare that number to the non rural proportion. So, first, let's just look at the states that cover these three innovative policies. First, we look at dental health waivers. I was quite surprised. I thought more states would be implementing Medicaid dental waivers, giving their kind of rapid proliferation over the last decade. But as far as dental Medicaid waivers, only 5 states, these states here in blue, um, have adopted such a waiver to modify and considerably adapt their Medicaid dental program. And quite interestingly enough, even though only 5 states, a relatively small proportion, not a very large difference, but still a slight difference in the number of rural adults living, proportion of rural adults living in a state that has uh, implemented such a waiver. Now let's look to the middle here. Let's look at the oral health action plans. And this is a little bit more of a popular program. And we see that 20 states have adopted such a state action plan to either build up the capacity of dental clinics, potentially modify delivery or reimbursement or training. There's a lot of creativity allowed in these action plans. Unfortunately, despite the popularity, it appears, if you see in this table here in the bottom left, that rural adults are considerably underrepresented compared to non rural adults, where 45% of all non rural low income adults are living in a state with an oral health action plan compared to less than 30%. So less than 1/3 of low income rural adults live in a state that have adopted such an action plan. And this is for maybe future research, but we intend to focus on exactly what are in these action plans, and we're seeing very little attention directly to rural adults. So not only are we seeing less representation um, across the country, even within states that cover uh, or adopt a waiver or adapt their program through an action plan, we're not seeing a lot of attention going to rural adults. So now let's go to the big one. This is kind of the hot topic this year, and I expect it to be for quite some time. So teledentistry is designed to meet the needs of an adult or child who can't get to their um, their primary dentist, whether it's because of mobility issues, transportation issues, or just geographic distance, or quite frankly, unavailability of providers. So it's very much a policy that's designed to meet these specific needs of rural adults. Unfortunately, again, we see, while only 9 states, and it's kind of the more, as we'll see, some of the leaders in innovation, a lot of states on the West Coast, Minnesota, adopting teledentistry. And I will say this was all before the pandemic. So we will see how things change. But anyways, so 9 states have adopted and reimbursed teledentistry for Medicaid dental services. Uh, but we see here that while 35% of all non-rural low-income adults live in a state that covers teledentistry, only 18% of rural adults living in poverty live in a state where they could access teledentistry, and that is quite problematic, considering that this the entire intent of this policy would be to bring dental services, bring dental access to people where it's not geographically available. So at the time of this study, right before the pandemic, we found a major gap in the intent of a policy to increase dental access for rural Americans, especially low-income rural Americans who face some of the greatest burden of poor oral health outcomes. So just to conclude, when comparing these policies across states, low-income adults were less likely to live in states with teledentistry benefits, and also less likely to live in states adapting their Medicaid program through a waiver or a plan. So we believe that this study highlights the disconnect between the need for teledentistry and innovative policies accommodating the reality of rural dental shortage areas. And I'd like to thank you for listening to my presentation. If you have any questions, I would be more than happy to follow up and engage throughout the conference. Thank you very much, and take care.